Patino and I are going to continue our conversation for you, the audience, about ADHD, and in particular, the controversial aspects of it really are how to treat it. So many people out there, doctor, you remember with my stepdaughter, but also you've treated many people. I myself, as being a former teacher, had this come up a lot of times with parents, and the big controversy of treatment is really what to do. A lot of parents are fine, throw pills down my kid's throat, let's move on. Others are really against that kind of approach. What is it that a parent should be looking at, and what treatments are there for this it's not disease but disorder?
You know, eh, After 34 years of seeing this and seeing the evolution of this diagnosis, actually, not only in terms of recognition, but strictly from the scientific clinical perspective, we actually changed it over time since the 1960s until now. So, step number one, as we talked last week, is recognition, right? Let's recognize that something is not right. So, as parents need to take the approach of maybe this is something that I cannot fix myself and that is not related to me doing something wrong. That becomes very important on allowing yourself to look for options. So I always like to tell parents that our job as physicians, pediatricians, psychiatrists, psychologists is not really our job to tell parents what to do. It is our job to try to identify the most likely condition the child is suffering and then provide them with options. And the options need to come in biological, psychological, and social ways. All of that said, it becomes important that the parents realize that once the options are presented, choices have to be made, right? So the first step is identifying, second step is saying, okay, let's get a professional assessment. And once we get a professional assessment, ask the right questions, meaning what are the treatments available? What are the treatments biologically? What are the treatments psychologically? What are the interventions socially? What are the risks and benefits of providing treatment, right? Because in part of our options have to include an explanation of what is the likelihood of benefit from treatment, comprehensive treatment, and what is the usual problem with not treating, right? Because, like with any condition, if you come to me with appendicitis, let's say, and I am not a surgeon, but I practiced medicine years ago. So if I see a patient with appendicitis and I say, all the signs and symptoms you have make me think that you suffer from appendicitis, and we did an ultrasound that kind of confirms that diagnosis, and these are the risks, right? And these are the benefits. If we remove the appendix, we get a surgeon to remove the appendix, you're likely to do better, live your life normally. If you don't remove it, you could die, right? Okay. And then you get into the risks of the treatment. Okay, so if I have surgery, what are the potential complications of surgery? Well, the traditional three complications of surgery are the anesthesia that is required, the potential for bleeding, the potential for infection, and death, right? So that is kind of very straightforward, right? So when we get into issues related to psychiatric care, we really get into trying to explain to the parents what we know about the risks and benefits. And that's where the controversies come into play, right? So let me start backwards. Let me start with what is the risk of not treating, right? I mean that is what we know statistically is that if a patient has enough attention deficit disorder to cause a dysfunction in learning and to create impulsivity that is manifested in behavioral ways, then those kids are more prone to having injuries, right? Because they're impulsive, they take risks. There are higher risk of having, let's say, traumas, like falling from the bicycle, they're jumping too high, They don't consider the risk. They see a situation and they jump into it instead of considering the potential problems, right? So that becomes a little problematic, and we have to keep attention to that. I think there's a problem with your microphone. Can't hear you. Okay, so your sound is coming out funny. Try again.
Yep. Okay.
Okay, that's better.
All right. Well, I was just saying, asking. You said a lot of these children end up. If you looked at prisons, you said a lot of these people end up being criminals, or at least having legal issues. Correct.
Yes. I mean, what usually happens is that uh, we have the impulse control issues, right? So the kids take risks, and some of the risks may lead to arrest, may lead to criminal behavior, right? So we have to keep that in mind that some of these kids will have a different um, response because they don't have the ability in their brains to take split second, right, and decide what to do with their behavior. So they just react,
Mm.
and that may lead to problems with uh, impulsive criminal behavior. For example, they may walk into a house and they see a cell phone and they grab it and take it with them, right? I mean, for them is that there's a cell phone. I want a cell phone. I take the cell phone. For the people who owns a cell phone, it was stealing, right?
Hmm.
So you can start to get problems with the law because of that. You may impulsively do drugs when you're a teenager because you're not having the ability to measure risk. You may get into fights and then you can get arrested because you were fighting or get kicked out of school. So that is another complication of the untreated severe ADHD. Now, the other thing that we know, especially with teenagers, if they weren't treated as kids, is that they have a lot of motor vehicle accidents,
Mm.
right? So, because they're impulsive, I always like to tell parents, listen, if you hyper focus on one thing and negate everything else, and you're a lot into music and you're driving your car, and all of a sudden you're trying to change the radio station into something you like, or you're trying to play with a cell phone and connecting it to the electronics of the car, all of a sudden you stop paying attention to the road and then you have an accident,
Hmm.
right? So distractibility is a problem. And statistically, if you look at motor vehicle accidents in terms of patients with attention deficit disorder, you're going to see that they're significantly overrepresented, right? Then you have the issues related to education, of course, which is your inability to problem solve and pay attention and being distracted and being problematic in the classroom is going to lead to other issues. Now, in my business, we call attention deficit disorder a highly comorbid disorder. What does that mean? It means that frequently comes with other things. So it's not unusual that genetically patients that have attention deficit disorder also have a tendency toward depression, also have a tendency toward bipolar disorder, also have a tendency toward anxiety. So untreated ADHD makes those conditions even worse.
Mm.
So there's a risk of suicidality that goes higher in the patient that have more than one condition, like attention deficit disorder with bipolar disorder, or depression with bipolar disorder, or generalized anxiety with bipolar disorder. That in my business, because I work in the inpatient side of adolescent psychiatry, we see a lot of these kids who end up in the hospital with suicide attempts, aggressive behavior, running away from home. They have a multitude of issues, right? So another one of the complications is substance abuse, as we talked before, because the inability to measure risk, or let me take that back, because it's not they're not even attempting to measure it. They just don't. They don't measure risk because they act impulsively. So if you are with a friend who's experimenting with the drug and you pass this over to you, you're not gonna think, should I do this or not? Just do it,
Mm.
right? But I mean, it sounds kind of simplistic when you're in the seven, eighth grade, nine, 10th grade, and somebody starts smoking pot, and then you try it, right? Now, once you start getting into higher levels of adolescence, 16, 17, 18, the playground gets a lot bigger, the playmates get a lot more dangerous, and you end up with more serious drugs like cocaine, amphetamines, which actually patients with attention deficit disorder get drawn into.
Is
All
that
right.
partially because some of the things like Adderall actually help their situation? The little uppers actually help them?
Yes, patients that have attention deficit disorder, initially when they start abusing cocaine or amphetamines, they tend to concentrate better. And you have actually two groups. You have one group of kids who like the fact that they slow down, that they're less aggressive, and they can concentrate better. But there are other individuals who don't like that effect
Mm.
because they were hoping to get a high from cocaine and amphetamines, and in reality, they get mellowed down
Mm.
because now they're not as impulsive. Now they can concentrate better because the release of dopamine that is created by cocaine and amphetamines allows them to concentrate and problem solve somewhat better, right?
Interesting.
Not forever though, because once you start abusing these drugs consistently, things tend to get worse.
Okay, so as they're young, they have a higher tendency to accidents. Once they get driving, much more so. Impulsivity leads them to use drugs and take risks. What about sexual behavior? Do they have increased STDs, unwanted pregnancies, and these things?
Oh, absolutely. I mean, just like they were impulsive in using drugs, they're impulsive in cross criminal behavior, they're impulsive in terms of aggression, they're sexually impulsive, right? Because it becomes just wanting and doing without measurement of consequence. So the measurement of consequence is pretty much out there. Let me give you an example. I saw a girl today. She's about 15 years old. She comes to the hospital with suicidal behavior because she had sex for the first time with a boy in her bedroom. Uh, the parents notice that the boy get out of the window, and then they start confronting her, and she tells them that she had sex. But when you start talking about the reasons for having sex, right? They become very concrete. And she does have attention deficit disorder. And the reason was, well, there was a competition among the girls about who was going to have sex first, right?
Yikes.
So that's pretty impulsive, right? That
Yeah.
is action, no consequence. And she ended up in the hospital, not necessarily because she was truly suicidal, but because she felt that she couldn't handle the emotionality related to confronting her parents.
Mm.
There were some other issues involved there, but the reality is that we see those behaviors all the time, right? So we have to identify the kid who is at risk for these behaviors as early as possible. Hopefully by the time they're in first grade.
So you said before and it's obviously it's very important because if you see the potentialities, ADHD is not something to be taken lightly, of course, because of what could happen. But you also mentioned before the show that the amount of kids being diagnosed with it has gone up exponentially. Why is that?
Well, well, there's a number of reasons. I think the most significant reason is the acceptance and the fact that we're recognizing it more. Um, I think that also there's an issue related to parents having less children.
Mm.
So when I grew up, there were five of us. So I mean, it can be chaotic when you have five, six, seven, eight kids, and you're trying to pay attention to all of them. You're really not paying attention to any of them. So kids were getting lost. There was not a strong impetus from the schools on trying to identify these kids. Since the advent of the American with Disabilities Act, we includes attention deficit disorder, and the fact that we have to have a specialized educational processes for these kids, then the schools are starting to identify more. They
Mm.
become more accepted, right? I think that also these kids become less rejected. There was a time when these were the bad kids. You didn't want your kids to play with them. So there was a kind of a natural selection, negative selection process of having these kids move toward isolation that actually provoked more criminality and more gang and more impulsive types of behaviors that for as long as they were not in the average society, people didn't care much about.
Mhm.
Hence the fact that, as I said this last time, 40% of prisoners in the United States are likely to suffer from some degree of attention deficit disorder, among other things, and they're not treated.
Wow.
And that's pretty high.
That's very high. Yeah, that's
Yeah.
incredible. So, we you said obviously identifying it early, understanding that it is worth treating because of the potentialities down the road. What are the basic treatments that parents are faced with choosing? Again, back to your role of showing the options. Once you've said, "Hey, this is what it is," what are those options?
Well, we have to start with the most effective treatments for the symptoms. Now, I do have to say there's not one treatment that works for all patients with attention deficit disorder. And the selection of the treatment has to be directly related to the intensity, the frequency, and the dysfunction, as we mentioned before. So, the one that has the most intense symptoms may require the most aggressive treatment, right?
Mhm,
So if you were having a comparison to the treatment of diabetes, right, you would say, well, your blood sugar is 500, you need to go on insulin, you need to go on these medications, we need to monitor you for low blood sugar. We have to have a plan of action for you so you don't have issues related to your diet and problem with your eyes, your kidneys, all that. So you have the biological component, the psychological component, and the social component. Now, on the biological side, which tends to be the most controversial one, we have medications. And
mhm,
medications in the treatment of attention deficit disorder have to be categorized in two groups: the medications that are stimulant based medications, that are amphetamine based medications, and the medications that are not amphetamine based, right?
mhm,
The most effective and quickly acting medications for that severe attention deficit disorder are the stimulants. And you're going to hear a lot of names of a lot of different medications, but they basically come in two groups. One is the Ritalin, famous Ritalin group, and the Adderall group. One is a combination of natural amphetamine salts. The other one is a artificially produced pharmaceutical. But they both do the same thing in the brain,
mhm,
which is the release of dopamine. By releasing dopamine in the frontal lobes, you allow the patient to be less impulsive, to concentrate better, problem solve better, right? Now, the controversy with the stimulants, whether they are in the Ritalin family, like Ritalin, methylphenidate, Concerta, or the Adderall group, where you have Adderall, you have Dexedrine, you have medications like Vyvanse. Those groups, since they all do the same thing, and they also have similar side effects, there are not a lot of differences, even though there might be individual differences on how they metabolize the drugs and what kind of side effects they have.
mhm.
These medications have serious problems with your appetite, and that's what created a lot of controversy over the years in terms of, do I want my kid to not be eating, right? So that's something that the parents need to know so we can have a plan of action for the appetite issue. For example, make sure your kids eat before they take the medication. They may not be very hungry for lunch, but they will be hungry for dinner. Now, so you have to work around the side effects, which decreased appetite is probably one of the most common ones. And these are the individuals that are in the growth process. We want to make sure that they grow properly.
And of course, the biggest issue with that is people say, "I don't want to have my kids on speed." Right? We hear those type of flippant comments, but that's not really what's going on here, is it?
No, because these medications, actually, a couple of things. One, they're pharmaceutical grade amphetamines, either artificial or natural. Second, they are medications that only work for a period of time, right? And nowadays we use a lot of the long-acting medications that last between 9 and 12 hours, right? Which is when the kids are getting most of their education. Um, Now, I do have to say though, and I always talk to parents about this: if the kid's going to school and is doing sports, the people who the school and the sports are going to see the best of the kid. By the time the kid gets home, the
Mm,
kid doesn't have a lot of medication on board. So the parents always see the worst part of the ADHD at home, right? And
interesting.
there are techniques to handle that. Now the other issue with a stimulants that we need to be concerned about is that if you have cardiac issues, you should not take these medications, right? And if you have issues with losing too much weight, sometimes we recommend a break during the weekends. However, that is kind of a response that has occurred for a long time from parents of not wanting their kids on the medication on the weekend because they're not going to school.
Mm,
I always have to remind parents that ADHD is a 24-hour a day problem, and your kids are always learning, even if they're not in school. They're learning when they're with you, they're learning when they're playing, they're learning a lot of things. So I actually recommend that the kids take the medication all the time, just like patients with epilepsy take medications all the time, not only when they're having seizures, right? So there is a quality of prevention of potential complications by taking the medication all the time. Um, there are a lot of newer formulations of the stimulants, but they're more like tweaking of how long it lasts, side effects, you know, uh, doses that have a multitude of curves at the time that gets released in your body. But at the end of the day, they're all doing the same thing, which is releasing dopamine.
so if they don't want to go with the stimulants, what are the other options when it comes to medications?
Well, there are two groups of medications that are used. One is FDA approved medication called atomoxetine, which is a norepinephrine dopamine medication that is more related to the antidepressants than the stimulants.
Mm,
It's not a controlled substance, but it works differently. It means it doesn't work immediately like the stimulants. The stimulant, if you take it, you get the effect. If you don't take it, you don't. And it doesn't create addiction. It doesn't create tolerance over time. It goes in and out every day. Now, with the atomoxetine, it's more like taking an antidepressant. It may take 2 to 4 weeks for you to see the effects. Doses have to be increased exponentially. You start with low doses, particularly because it's a little upsetting to the stomach. So you start low doses with food, and you keep increasing the dose to a maximum of 100 milligrams a day. It can be very effective. In my experience, it's more effective with the inattention than the hyperactivity. Okay, stimulants are very effective on both. And atomoxetine takes time. Okay, and is not as dramatic in its effect as a stimulants, but it's a very good medication. There is a non-FDA approved antidepressant called Wellbutrin that does a similar thing that can also be used for attention deficit disorder in certain cases. And then you have another group, it's called the alpha adrenergic drug. These drugs are actually blood pressure medications
hmm,
and not unusually are given to the kids at night to help reduce their insomnia and impulsivity before bedtime. So they can be very effective on helping inattention. However, when you give it during the daytime, kids tend to get tired
hmm.
because the blood pressure drops a little bit. So that's kind of like the universe of ADHD medications. Um, and it's becoming much more popular nowadays to use it in adults that were never treated as children, right? If we identified that they did have attention deficit disorder as children but were never treated, they continue to have a lot of symptoms that not unusually get misdiagnosed with other disorders, right? Like anger problems, personality problems, depression, anxiety. So we have to be able to recognize, again, and I have to say this once more, that attention deficit disorder is a lifetime disorder. It never goes away. You may learn to cope with it better, but it's always there. And
Well,
then
having sorry, go
go ahead.
ahead, sir. Well,
No,
having
go ahead.
been through this process and not an aside, as you know, I was just the observer, and hearing the comments of the parents concerning the child. The one that I remember hearing over and over again, and also with the kids that I taught, was, "I don't want my kids on drugs because it will change my kid's personality."
Well, you see, the problem with that statement is that it assumes that the kid's current personality is adaptive,
Yeah.
right? So some of these kids are very not are very happy, careless. Uh, they don't bother anybody. They just go and do their thing. But that doesn't mean that over time they're not going to have some complications. So the whole idea of it's going to change my kid's personality assumes that the kid has a set personality to begin with. The kid's developing a personality. And if the kid has attention deficit disorder and is not treated, it's going to most likely go into the wrong side of the personality the parents are trying to avoid. So you have to recognize this is not a defect. This is not a weakness of character for the child. It's not a weakness of character for the parents. It's a neurodevelopmental disorder. That's how your kid was born. Think of it as autism in a different part of the brain. The
Mm,
connections of that brain are not working properly, and the kid's going to have certain characteristics that are going to impede their ability to develop a healthy personality and potentially a lot of complications. Now, here's the other part that parents need to understand, because we also have a number of parents who want the pills to do everything, right? I want something to fix my child. Well, it doesn't work like that, because your human, your child, is a biopsychosocial entity. So it's not only needing attention to learn and to grow, but needs to interact, right? So the how to learn to do things differently is where the therapy comes into play. And
mm,
we relatively recommend kids with attention deficit disorder to get involved in cognitive behavioral therapy that is going to guide them into the how to practice new ways of doing things. And a lot of that is actually done in the school by the teachers, in terms of special education plans or IEPs, individualized educational plans, for them to be able to learn how to utilize their attention properly, right? Like if you're diabetic and you take insulin, you need to learn how to eat.
mm,
You need to learn how to take care of your feet. And cognitive behavioral therapy gets involved more with the how than the why. The kids with attention deficit disorder, even though are exposed to more risk of abuse because of their intensity, should not get into inside oriented type of therapies initially, because they don't have the attention to introspect either,
mm,
right? So you have to teach them the how to. And maybe later on, if they need other types of therapy, will be fine. Also, the social environment becomes very important. So that's where the parents play a crucial role on the rehabilitation of a kid with attention deficit disorder, because the parents have to be non-judgmental and neutral, and they have to listen more than do, and they have to be willing to recognize that what is happening to their child is not their fault. And this becomes extremely difficult, because about 70% of kids with attention deficit disorder have one parent with attention deficit disorder. So it's kind of interesting to see a parent and a child both with attention deficit disorder trying to communicate with each other. Okay. So not unusually we will diagnose kids and then we will treat the parents too,
hmm.
if the parents
Incredible.
have the disorder. Yeah.
Well, thank you, doctor. I mean, it's really important, I think, for our audience to understand that, as you said, first you got to get through the ego issue. Your kid's not defective; it's just a disorder. It's something they're born with, has to be managed, psychologically, socially, and biologically. And I think the greatest challenge, at least what I observed, is that biological part, the hesitancy to treat in the first place, and if they do, the real hesitancy toward this meds. Really appreciate how you explain that. I think it'll be some good information for our readers, our listeners out there. Of course, like, subscribe, and share. And hopefully, we'll talk a little bit more about this maybe next week. What are we looking at for next week? We'll
No, I
preview.
think we're going to continue a little bit more in more detail with the issues of complications and comorbidities associated with attention deficit disorder.
Okay, we'll
Hey,
Have a good one, and we'll see you next week.
Thank you, everybody. We'll see you next week.